punarutpadyanti. It is clearly explained about skin elevated circular patches. Here, how to differentiate the Dadru Kushta and other diseases. Here, I will tell one thing. See, here round type of patches in clearly explained in Samhitas. One is Dadru, second is Vicharchika, and third is Kitiba Kushta. In three diseases, patient come with circular patches only. Here in Dadru, in clearly explained Utsanna Mandala, that circular patches. These circular patches, these patches is consist with pustules like this, and central is very clear. But in Vicharchika cases, it is also circular, but the central space also consists with any papules or pustules, any watery discharge. But in Dadru cases, only circular, that papules only present, central is very clear. But in Kitiba Kushta, this is also circular patches only, it is very scaliness is present. Sometimes that is Snigdha Kitiba Kushta are present. In this also small pustules present also there. It is also very rare case, but here in Vizag and any other districts we will see only Roksha type of Kitiba Kushta. So you have to diagnose like this. Central clear small pustules in Utsanna Mandala, that is clearly explained Utsanna Mandala, that circular elevated patches are present, and these are the symptoms: Kandu, Pidika, Raga, Srava, Atashi, Pushpavarna, Shota, and this is the main. Prasantaniyacha Punarutpadyanti. This disease will subside and again reoccur. That's why we have to treat very carefully in these cases. Second is Pama Kushta. Here Pama Kushta, Sveta, Aruna, Srava, Pidika. There is a scattered boils or eruptions present. Clearly explained that Spika, Pana, Pani and Pada and Purpara. Here it clearly explained buttocks, hands and forearm. These are the symptoms: Kandu, Toda, Daha, Pitika, Srava. Here this is also, see how to diagnose the Pama Kushta in patients. This Pama Kushta actually it's come with in fingers joints, or this is elbow joint or buttocks region, and this ankle joint. These joints are present, scattered, only pustules present. After the pustule, it open and it comes as that burrow-like structure. That is the explained as Pitika. And Srava ooze comes out from that lesion. This is the Pama Kushta. So in these both diseases, it is a Sankramika. So one vehicle is important. That vehicle is the Krimi. Here Krimi also in Vimanasthana clearly explained Bahya Malaja Krimi. These Bahya Malaja Krimi transmitted from one person to another person. The disease develops from one person to another person. That is, it called as Sankramika Roga. So this is the Samprapti of Dadru and Pama Kushta. That is the, whatever that first slide I explained, Sankramika Roga. That is the Prasangat, Gatra Samsparshat, Nishwasat, Sahabojana, Sahasayana. That is the sharing bed, class, etc. That is infected person, that contagious diseases, Sankramika, that transform to one person to another person because of this Malaja Bahya Krimi. That Krimi entered into Tvak through Sveda and vitiates Tvak, Rakta, Lasika and Pitta, Kapha Pradana Tridosha. That Sankramika Bahya Malaja Tvak Vikara develops. That is the Pama and Dadru Kushta. Here, treatment principle is very important. Whatever it explained in Charaka Shushruta, that you have to, Charaka Sutrasthana and Charaka Vimanasthana, you have to, that application is required in these type of cases for treatment. In these type of cases, we have to go for Nidana Parivarjana and Prakruti Vikata and Apakarshana. Here, Nidana Parivarjana is main line of treatment. Why? Because the disease transformed to one person to another person through that cloths and garlands like that. So we have to avoid that causative factors is the major line of treatment in these Pama and Dadru cases. And second is Prakriti Vigata. What is Prakriti Vigata means? It is a internal and external medication, Antar and Bahir Parimarjana Chikitsa. And last is Apakarshana. It is the Shodhana Karma. Here, Prakriti Vigata Chikitsa, that is Antar Parimarjana and Bahir Parimarjana. That is Antar Parimarjana means whatever you give internal medication. These internal medication also, one schematic prescription will be there in these two cases. That is the first is Krimihara medication. Whatever it come Pama and Dudra cases to you, Pama and Dadru cases, that time first we have to start with Krimihara medication. It is very important to treat this type of cases to stop reoccurrence. In allopathy, you have to go, the patient, they will give one steroid and one antihistamine drug, it subsides, again it will develop. That time only that patient come to Ayurveda. In this time, you have to give proper medication in these cases to stop reoccurrence of the disease. That is the main is Krimihara medication, and along with Krimihara medication, you have to give Nitya Vireshana medication and Rakta Shodhaka Dravyas, Kandugna Dravyas, and maintain the proper Roga Nirodhaka Bala. This is the primary line of treatment of Pama and Dadru, that is Sankramika Rogas. And second is Bahir Parimarjana, that is external treatments, Sarvanga Abhyanga, Ushna Jala Parisheka, and dusting powder, maintain proper hygienic. These are the Bahir Parimarjana Chikitsa. It is Apakarshana, Shodhana Chikitsa. In these two cases, Vireshana is required after the Krimihara Chikitsa. Here, Vireshana also Tiktaka Gruta with the special Vidanga Churna. You have to give Gruta with Vidanga Churna. At least 5 grams of Vidanga Churna you mix with Gruta. It is one of the special drug that Vidanga to stop the reoccurrence of the disease. And second is Sarvanga Abhyanga. After Snehapana, you have to give Sarvanga Abhyanga, especially with Estimadu Taila. Why Estimadu Taila here? It is a best Varana Ropana. So, you have to do Sarvanga Abhyanga with Estimadu Taila only. After that, Virechana, the Trivirut Leha and Tripala Kashaya. After that, Samsarjana Karma advice. Here, total topic is first Nidana Parivarjana. Second is Prakriti Vigata. In this Prakriti Vigata, first primary line of treatment is Krimihara Chikitsa with Nitya Vireshana. Next is Apakarshana, that is Shodhana. After Apakarshana, you have to give Rasayana Chikitsa and Kapha Pitta Hara, Rakta Shodhaka Dravya, Kandugna Dravyas. This is the major line of treatment to stop reoccurrence of the Dadru and Pama Kushtas. First, you have the examine the lesions. So that patient, after the visiting of allopathy doctors, then he will come to you. Then the lesions are very dry. Why? Because they are giving any antibiotics or steroids. The lesions are very dry. Don't confuse. Why? Because it is acute or chronic. You have to see. And this condition is Roksha or Snigdha. Then observe the disease spreading nature. It is fast spreading or slow spreading. Then start with Krimihara Chikitsa. Then internally you have to give Krimikutararas or Krimimudghararas along with Vidangarista. If intense itching present, add Kadirarista also. Then Arogyavardhani Vati, it is a Nitya Vireshana Dravya along with one Agada Dravya, that is a Bilvadi Gulika or Doshi Vishari Gulika. This Bilvadi Gulika or Doshi Vishari Gulika, it stops reoccurrence of the disease. It's very useful in my clinical practice. That Bilvadi Gulika very useful to stop the reoccurrence of this type of Sankramika Rogas. And then start. That is the after Shodhana Chikitsa, you have to start Kadirarista, Gandhaka Rasayana, any neem tablet, Nimbadi Kashaya or Patoladi Kashayam. It is the mixed powder for increase the immunity or maintain the immunity. Guduchi, Amlaki, Estimadu, that is a mixed powder. Equal quantity you have to mix it, then give 3 to 5 grams of powder morning and night. And external application, see here you have to concentrate, the lesions are dry, the lesions are wet. You have to observe the case, that is in snigdha condition, you have to give prakshalana. That is the kashaya prakshalana you have to give. In snigdha condition means the lesions are ooze or any watery discharge from the lesions, then only you have to give prakshalana, triphala or panchavalkala prakshalana, at least nimba with haridra, any powder you have to boil with water and prakshalana it. After that snana with any neem contained soap. After that dusting powder. It's very important, if any snigdha condition of the lesions, we have to dust the powder, then it will, the snigdha oozes will reduce. That is some pharmacies are prepared cutis powder, it is a Vasu Pharma. The derma charge powder, it is Emil and Dashapushpa Churnam. In Ruksha condition, the lesions are, it is very dry condition, then only you have to give oil application. If you give oil application in snigdha condition, the disease will aggravate. But don't give that. That's why you have to observe the skin lesions. Then only you prescribe the treatment. In Roksha condition of the lesions, you have to give oil applications. That Chakramardha is very beautiful drug to reduce the cases of Dadru Mandala. And Maricharithaila, it is very beautiful medication for reduce the Pama condition. And Aladi, Nalpamradi also you have to give. And Ushna Jala Parisheka, it is very important. If Snigdha condition or Roksha condition, you have to give Ushna Jala Parisheka, Snana with neem soap, and some ointments, lapas, it is trichoderm, funguin, Desura, AF. So, coming to conclusion, the incidence rate of Sankramika Bahya Malaja Kushta gradually increasing day to day because of improper vihara like uncleanliness of body, sharing clothes of others, etc. In these two cases, Dadru and Pama, depending upon Nidhana and Lakshana, it was diagnosed as Sankramika Bahya Malaja Kushta. Nidhana Parivarjana is the main method of keeping oneself free from the disease. Krimihara Chikitsa is the first line of treatment, this type of Sankramika Tvak Roga. After Krimi Chikitsa, you have to do Shodhana Karma according to the disease condition. After that, you have to give Rasayana, Kandubna and Rakta Shodhaka Dravyas. External treatments always depends on the conditions of the lesions. Thank you one and all. So if you have any doubts, you ask me about that Sankramika Rogas. In your OPD, these two cases will come regularly. But after Ruksha condition only it will come. The patient already used the antibiotics, steroids, all used medication, that disease totally suppressed. It means already Charaka clearly explained Lena dosha. That dosha is present in Dhatugata level. If any Nidana factors, the patient exposed to Nidana, that Lena dosha again develop the disease. So, because of antibiotics and steroids, the disease fully subsides with Dhatugata level only. It secretly, situated in Dhatugata level. If any uncertain circumstances, uncertain causative factors, that disease again reoccur. So, you go with the Ayurveda treatment, that is the Krimihara Chikitsa, and next Shodhana Chikitsa, next Shamana Aushadhi and Rasayana Aushadhi, and that immunity development powder, then the disease will totally relapse. Okay, no reoccurrence in the skin disease. You treated like this only, no reoccurrence in Ayurveda. Otherwise, the disease will reoccur. Okay, be careful like treating the disease like reoccurrence like Sankramika Roga diseases. Thank you one and all.